Many people notice a new skin growth and immediately think two opposite things. Either they panic and assume it must be cancer, or they ignore it completely and assume it is harmless. The real problem is that most people cannot tell the difference. Some harmless lesions look frightening, while some dangerous lesions look completely normal at first. This is why many skin cancers are detected late. So today I will explain 5 skin growths you should recognize immediately. The first and most common skin growth is seborrheic keratosis. Sometimes it is called a marker of skin aging because it is almost absent before the age of 30, but after the age of 60, almost everyone has at least one. This lesion usually looks like something sitting on top of the skin, rather than growing deep inside it. Many people say it looks like it could be peeled off, almost like melted candle wax stuck on the surface. There is an important difference between seborrheic keratosis, moles, and warts. Moles are usually smoother and part of the skin. Warts feel rough and dry. Seborrheic keratosis usually has a waxy, slightly greasy, shiny surface with a stuck-on appearance. Its color can vary widely. Most often it is light brown, dark brown, or sometimes almost black. Because of this dark color, many people worry that it could be skin cancer. But unlike melanoma, seborrheic keratosis usually has a uniform color, rather than irregular pigmentation. When you look closely at seborrheic keratosis, the surface often looks a little like the surface of the brain, meaning it has a crumbly and textured pattern. These lesions are most commonly found on the chest, back, shoulders, face, and sometimes the scalp. They are rare on the palms and soles, which helps differentiate them from warts. At first, there may be only a few lesions, but over time they can become dozens. Usually, seborrheic keratosis does not require treatment. If removal is needed for irritation or cosmetic reasons, the most common treatment is cryotherapy, where the lesion is frozen. Another option is curettage, where the lesion is gently scraped off under local anesthesia. The second common skin growth is the skin tag. These are very common after the age of 50, and almost every second person has at least one. A skin tag is usually a soft, skin-colored growth that hangs from the surface of the skin. The most important feature is that it has a thin stalk connecting it to the skin. Skin tags usually appear in areas where friction occurs. Typical locations include the neck, armpits, groin, eyelids, and under the breast where skin rubs against skin. But there is an interesting metabolic connection here. When a person has multiple skin tags, it is often associated with insulin resistance, obesity, and type 2 diabetes. That is why if someone develops many skin tags, it can be useful to pay attention to blood glucose and metabolic health. The best prevention strategy is maintaining a healthy body weight and reducing excess weight. Skin tags usually do not require treatment, but they can easily be removed if necessary. Common procedures include cryotherapy, snip excision, where a doctor cuts the tag off with sterile scissors, or laser removal. The third common skin growth is the common wart. Warts are caused by infection with human papillomavirus. Many people know papillomavirus because certain types are associated with cancers such as cervical cancer or penile cancer. But the virus types that cause common skin warts are different from the high-risk types associated with cancer. Warts spread through direct skin-to-skin contact. It is also possible to spread them to other areas of your own body, especially during shaving or scratching. People with weakened immune systems often develop multiple warts. In the natural course of the disease, about half of all warts disappear within 1 year, and around 70% disappear within 2 years without treatment. The most common first-line treatment is salicylic acid, which slowly dissolves the thickened skin. It is widely available over the counter. Other treatment options include cryotherapy, laser therapy, and sometimes immunotherapy. There is an important point many people misunderstand. When people try to cut off warts or skin tags at home, they often bleed easily because these lesions contain many capillaries. Even if they are cut, they often grow back. Cutting warts at home is not recommended because the virus can easily spread to nearby skin. The same idea is often mentioned about seborrheic keratosis and skin tags. If you irritate or cut them, they do not turn into cancer. They may bleed or become inflamed, but irritation itself does not transform them into cancer. The reason this myth exists is historical misunderstanding. Sometimes a person repeatedly irritates a lesion believing it is harmless, while in reality it was already melanoma or squamous cell carcinoma before the irritation began. However, it is important to mention that chronic irritation lasting many years can increase cancer risk in specific situations, such as long-standing scars, burn scars, or chronic ulcers. But this is a completely different situation from occasional irritation of benign lesions. The fourth common skin growth is the mole. Moles are benign growths made of melanocytes. These are the cells that produce melanin, which is why most moles are dark. Most adults have more than 10 moles. In most cases, they are harmless and remain stable for many years. However, because melanoma, the most dangerous skin cancer, also originates from melanocytes, moles receive special medical attention. Most moles are brown and remain unchanged for decades. There are several types. Junctional nevi are flat and dark brown, and are more common in children and adolescents. Compound nevi are slightly raised brown moles often seen in young adults. Intradermal nevi are dome-shaped and sometimes skin-colored or light brown, and these are more common in older adults. The main factors that influence mole development are genetics and sun exposure. As a general rule, moles smaller than about 6 millimeters, roughly the size of a pencil eraser, are usually considered low risk. Can a mole turn into skin cancer? Yes, it can happen, but it is not the most common pathway. Around 20% of melanomas arise from pre-existing moles, while most melanomas appear as new lesions. The risk of melanoma is higher in people who have more than 50 moles or atypical moles. These atypical moles may be asymmetrical, have irregular borders, contain several colors within the same lesion, have a large diameter, or change over time. Cutting or injuring a mole does not cause cancer. Trauma can lead to bleeding or inflammation, but it does not transform a benign mole into melanoma. Suspicious moles should be removed surgically and sent for biopsy to confirm the diagnosis. Now we come to the most important part, because we need to know when a skin growth becomes dangerous. There are 3 major warning signs that suggest possible skin cancer. The first sign is rapid change over weeks or months. If a lesion changes its size, shape, or color, especially in the case of a mole, this can indicate melanoma. The second warning sign is bleeding or ulceration. If a skin lesion bleeds easily, forms ulcers, or repeatedly crusts and does not heal, this may indicate squamous cell carcinoma. The third warning sign is an irregular appearance. Asymmetry, uneven borders, mixed colors, and an uneven surface are typical features of melanoma. The 3 most important skin cancers are basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common skin cancer. It usually appears as a pearly or shiny bump with rolled edges and small visible blood vessels. Sometimes there is a central ulcer. These lesions grow slowly and often appear on sun-exposed areas such as the nose, face, ears, scalp, and neck. Basal cell carcinoma rarely spreads to distant organs, but if untreated, it can destroy surrounding tissues. Squamous cell carcinoma is the second most common skin cancer. It often appears as a rough, scaly patch, a thick crust, or a persistent ulcer that does not heal. Sometimes it presents as a firm red nodule. Major risk factors include age, long-term sun exposure, and chronic scars or ulcers. Compared with basal cell carcinoma, squamous cell carcinoma tends to grow faster and has a higher chance of spreading to lymph nodes. Finally, melanoma is the most dangerous skin cancer. The classic description follows the ABCDE rule. The lesion is asymmetrical, meaning the 2 halves do not match. The borders are irregular with jagged edges. The color is uneven and often contains multiple shades. The diameter is often larger than 6 millimeters, and the lesion evolves over time. Melanoma most often appears on the back, legs, arms, and face. It can grow quickly, invade deeper tissues, and spread to other organs. That is why recognizing suspicious skin growths early is extremely important.